Okay, thank you.
Yeah, so it's recording now.
Thank you. So as I was saying, really to thank all of you for finding time to join us. We most heartily appreciate our guests who've spared their times, and this is a very busy season for you. Dr. Dawa, Dr. Akoto, who is still trying to join us, Dr. Ron, who is already with us. Unfortunately, I have just gotten a call from Ms. Merab from the Nation Media. She's been taken ill, and she passes her apology, but she said should she feel better even towards the end of the call, she'll still try and join us. If it is okay, I could request Nerima to just give our guests a brief overview of what Imara is and what we are trying to do in about 2 to 3 minutes, and then we will and then we'll pick up the conversation again from there.
Good morning.
Morning, Nerima.
So, good to see and hear all of you. I'll just give a brief about Imara. I know that Dr. Dawa needs to leave at 11, so I wouldn't want to take her time in her introductory. But basically, Imara started last year, and so it's the second cohort that we're in. And we have fellows from different parts of the country, though we mainly focus in Kericho, Kisumu, and Busia. But then this year, we have fellows who joined us sometime late last year. We also have some alumni, like Dr. Rono, who's part of this chat. But what it is to basically engage young people in policy processes. We would like to capacity build them to be interested in policy making processes. Not all of us here have a background in policy, including myself, but we have an interest in policy and just see the strength in how engaging young people as stakeholders in policy-making processes and the changes that it can make in the community. This is a partnership between AYLF, Macapil, and Siasa Place as well. So there's 3 organizations that host this program. Thank you.
Thank you, Nerima, for that brief introduction. So, Dr. Dawa, thank you for your time, and so that we are able to have you for a bit of time, for a few more minutes. I think I'll be speaking for everybody if I asked you, are we all gonna die by the time this is over? Why has this, COVID-19 disease attracted so much attention and global concern? And is there anything, of a similar nature that has happened in the recent history that we can look up to get some clues of how this is going to pan out?
Should I go first?
Dr. Dawa.
Oh.
Okay, so thanks for the questions. So just to let everybody know, my background is in health policy and infectious diseases, and I work for Washington State University, and we are trying to support the ministry as best we can with this COVID-19 outbreak. So regarding the question of, are we all going to die? The answer is no. Even in the worst case scenario, most people are going to survive. But when it comes to the question, why is there such a hula baloo about coronavirus? It's the fact that it's a new virus, it's a new disease. We don't know much about it. We don't have, as far as we know, there's no pre-existing immunity against it. So even though most people, when they get it, they'll survive, if a lot of us get it, the numbers are very high. So for example, if we look at Kenya, we have a population of about 45 million. If we say in the worst case scenario, 36 million Kenyans are going to get infected. We know 80% of them will recover, but 20% of them will get some form of severe illness and require, let's say, hospitalization. So that means 7.2 million Kenyans will require hospitalization. And then you say, well, out of all of those people, there are some who require ICU care, maybe 5%. So we'll have 360,000 Kenyans needing ICU care. But we only have, right now, we only have about 600 beds, 600 ICU beds. And then when you look at the deaths, the issue with the deaths is still something that's evolving.
Yeah.
But so far, we think the reported cases, about 3 to 4% will die. So if we use those sort of numbers, we are saying maybe 200,000 Kenyans will die in a worst case scenario. And already every year, 300,000 Kenyans die. So it's like a doubling of the deaths that we'll see during this period. But that's only in the worst case scenario. If we manage to flatten the curve through all of these measures the government is talking about, then we shouldn't see these crazy numbers that I'm talking about. Dr. Rono?
Alex, we will not die. I agree with that. That problem is audio. Can you hear me?
Yes, we can. We can hear you, Dr.
Okay, good. Yeah, I was hearing some noise. So we will not die, Felix. I agree with Dr. Dao that even in the worst case scenario, there is still a possibility. I mean, it is true that most of us will definitely get through it. When you see the current statistics, you will realize that 95% of patients are having mild disease. Some of these people, even in other jurisdictions, are encouraged not to come to hospital. And they'll just be well without even needing to come to hospital. So it's only the 5% that we are worried. And this 5%, even though they are in critical condition, majority of them will also still live. If we put in the measures like it's been said, having the hospital system managing to handle this case. Okay. We've faced difficult times before. For instance, there was I think, was it the Spanish flu? And it killed a lot of people. Conservative estimates, I think it's around 25 million people or something. If you see the way coronavirus as the mortality currently, we are around 60,000 as of today, and projections are that maybe perhaps we may not even reach 5 million mortalities. We don't know yet. So when you compare with the plagues that have happened before, there is a hope that this one will not even be as bad as the previous ones. The only challenge, of course, is that in this current information moving so fast, then we are able to know that people are dying in several parts of the world, and it brings a lot of fear to people. But there is all the reasons for us to be optimistic that even this shall come to an end.
Thank you, Dr. Ari. And we've also been joined by Dr. Akoto, who is the KMPDU rep from Bungoma County, a very good friend to our community, and he's also doing his master's in public health, specializing in health policy. Karibu, Dr. Ari. So I'll be roping you in a few seconds, but just to go back to Dr. Dawa, we are told that you know there are a lot of analysis and what government is doing about how we can really flatten the curve and mitigate the impact of these pandemic as well. But I want to flip this slightly and ask you, because I feel that if we are truly to overcome this pandemic, then where this war will be won is in our communities, you know, in our households, in our informal settlements, in our village and rural setups. So as an expert, do you feel that we are adequately prepared, that we have adequately prepared our communities to really be our frontline heroes, as it were? or is there something more that needs to be done in that regard?
So Felix, thanks for that question. And I absolutely agree with you. When it comes to COVID-19, this battle will be won or lost in the community, because it's not the healthcare workers that are going to flatten the curve. Flattening the curve is really going to take place in the community. That's why, as the Infectious Diseases Society of Kenya, we produced an advisory opinion. And part of it talked about community engagement, that the government must bring on board the community. The community must work with us. They must understand why we need to do this. And like, for example, when the government says, you know, wear a mask, people need to understand we're wearing a mask because this virus is spread through droplets. When they say social distancing, community needs to understand when you stand too close to somebody, when you hug them, when you kiss them, when you shake their hand, then you can transmit the disease. When the government says hand wash all the time, the community needs to understand that if you touch something that are contaminated, that is contaminated, and then touch your nose, your ears, sorry, your nose, your eyes, your mouth, then you can also get the disease. So forums such as these are important in spreading the word through the community that COVID-19 will be won by them. Because we'll reach a point in this pandemic where the virus, I mean, we won't be able to handle every single case in the hospital. And so some cases will be managed in the community and they'll be asked to isolate. But you know, somebody could be asked to isolate, have mild disease and still walk around. But it's the community who's going to help ensure that that person can stay home, that they do stay home, that if they come out, there's a means of reporting it. If they need help, you can help them with their shopping. So I think more has to be done with the community, but this is an important first step.
Thank you. Dr. Koto's bandwidth is a little low, so I think that is why there is a bit of that noise in the background. So I've requested him to try and kill the video so that we're able to see. So thank you so much for those insights. And let me shift another and ask Dr. Rono now this particular question. You are practicing, you're in the hospitals. How ready do you feel that our county hospitals are prepared to handle a potential influx of patients? And how prepared do you feel as a doctor who is on the front line? Please unmute yourself, Dr. Unmute your microphone. Dr. Rono, we can't hear you. Please unmute your microphone.
Can you hear me now?
Yes, we can. We can hear you now.
Yes, I forgot to introduce myself. My name is Dr. Edwin Rono. I work at Moi Teaching and Referral. Thank you, Felix, for your question. Well, while I don't really work for a county facility because MTRH is a national government.
Yes.
A parastatal. So our preparedness could be a little bit better. But since we serve the community around, I can speak for the preparedness of the hospital here. And in my own assessment, I feel we are adequately prepared because the triage system has been fully operationalized. We are able to capture those patients that we think are, in one way or another meet the criteria to being described as a suspected case. Now, when we meet these clients, then we refer them to a special team. We call it the rapid response team, of which I am part of that team. And we make a second assessment whether they meet the criteria for testing for COVID-19. And so far, I feel like we've we've adequately been able to put in structures at such a very short time to deal with the situation. Most of the other things that maybe I should speak on is the issue of personal protective equipment. As an hospital, I think we are fully protected as healthcare workers, but I think there is also need to always prepare for the future. We don't know, because the demand is going up for PPEs, and even in some of the places, even in some of the departments, you find that there is rationing of these PPEs, as you can see there. I don't know, can you guys see the video as I'm speaking? Or you can only hear the audio?
We can see you.
You can see me?
Yes.
We can see you.
I'm holding a, I'm holding a mask, and this same mask I've placed it very well so that I can use it once I'm done with this meeting. So there is also used encouragement for judicious use of PPEs. So we are fully prepared. We have the isolation unit, which is a 30-bed capacity, and there is room for expansion even into our nearby facilities. So if I can speak for this hospital, then I think we are fully prepared for this. As for the county hospitals, of course, I am not so sure, because perhaps one of the doctors who works for the county can advise.
Dr. Koto, at this point, I'd like to bring you in. So if you can unmute your microphone.
Yes, I can hear you, Felix.
Thank you and welcome. So you are part of the leadership for the medical profession, and I know that you've also worked with the county government of Bungoma, and you really well understand the county public health system. So my first question would be, if you can just take us through a very quick rundown of how is the county health system organized in terms of classification of hospitals. We usually hear level this, level that. How does that hospital system interface with other interventions within the community? Say we have community health workers, how do they come on board? And what do you, and generally your assessment, how well do you feel that that system is prepared to handle this pandemic should we see situations where rural counties and other counties beyond the 4 that are hotspots now get heavily affected?
Thank you, Long. I hope you can hear me.
Yes, we can.
Thank you. First is that I'm Dr. Koto Anthony. I work in Western Kenya, specifically in Bungoma County, for the last 7 years. I also serve doctors as their chairman for the union, Doctors Union, KMPDU, where I cover Bungoma, Vihiga, Kakamega, and Busia. So I feel privileged to be part of this conversation, and quickly I will take you through how our system is structured at the county level. First is that it has been classified. Tier 1 facilities or level 1 facilities are at the community level, and we are talking of those dispensaries. Then at the next level, we are talking about the health centers. We have those health centers that form the next tier. The next level, we have the sub-county hospitals. This is where we have the sub-county headquarters, former sub-county district hospitals in some cases, but now they are the sub-counties. Like in Bungoma County, we have 9 sub-county hospitals. And then next level, we have the county hospitals. These may not be necessarily county referrals. Some of them were level 4 hospitals in the previous arrangement. For example, in Bungoma, you're talking about Webuye County Hospital. In Kakamega, you're talking about Malava County Hospitals. These were former district hospitals. Yes. And then the next level, that is the highest, we are talking of the county referral hospital. The county referral hospital, in this case now, each county has identified one facility that it is using for purposes of teaching and referral purposes. So in a nutshell, that's how the system has been arranged. And at the bottom of the pyramid also, we have the community health workers or the community health volunteers who work with the existing units of the dispensaries and the health centers to try and give that community outreach to members of the public or the community. Now, apart from that, you also asked about our level of preparedness.
Yes.
And it is debatable. But as doctors, we feel we are not adequately prepared, especially at the county level. This is because generally there is a big gap in terms of infrastructure. It has been difficult even to identify areas where we can set up these isolation centers or the quarantine centers. It's still a big challenge in most counties, even in due respect. Also, in terms of equipment, preparedness, the technicalities are also challenging because, for example, Bungoma County, you saw in the recent report that was published in the newspapers. For example, Bungoma County does not have a single ICU in public facilities. What we have is in the private sector. Counties like Busia lack a single ICU both in public and in private sector. And Lone Felix, that is your home county. We do not have a single ICU, whether in public or in private. Vihiga County also, unfortunately, it doesn't have any ICU bed both in public and in private. Kakamega County, we have about 20 beds, 20 ICU beds, although only 9 are operationalized at the Kakamega Teaching and County Hospital. Yeah. Also, they don't have any bed in the private sector. So when you look at this picture, it tells you averagely, in case we had a patient who needs a ventilator or ICU care in Vihiga and Busia, then it means they'll have to seek these services either in Kakamega County, or they have to travel to Kisumu, or they have to come to Bungoma in the private sector for them to be able to access this. So it is still a big gap, which we are trying to ask the counties to prioritize and try to mobilize resources to be able to be prepared in that respect. Because as my colleague had earlier said, about 10 to 15% of the patients who will get this COVID-19 will get some form of moderate to severe illness. And out of this, some 2 to 5% of them may need serious care in terms of hospitalization and even ICU or ventilator care. So for that, we feel like we need to invest a bit more, to mobilize a bit more resources just to be ready so that we don't lose people in case we need to take care of them in that state. Thank you.
Thank you, Dr. Ari, for that very good rundown. At this juncture, allow me to request Dr. Dawa if you could just take a few questions, and some of the questions I'm picking them from the chat. But you mentioned earlier in your statement that you have, as a professional association, you've provided some advisory to the government on what you think can be done.
Hello? Felix, I can't hear you.
I think we lost him. I can't hear him too. I don't know what happened.
Okay, so we've lost Felix.
Looks like it.
Okay, even though we've lost Felix, there's a question here that I saw from Emmanuel Opio. Perhaps I can answer it. He's asked, how long do you estimate will be in this state of emergency? So Emmanuel, when it comes to this, I don't think any country in the world knows how long it's going to last. But when we did a model of the worst case scenario, that is, you have no interventions at all, we saw that this would probably end sometime in January 2021. But that is worst case scenario when you do nothing. In this current situation, we are putting in place measures. So if you look at models, let's say from the UK, especially because there's been the ones who've been producing a lot of mathematical models, they estimate that we will have a series of intense interventions. Then once we see the cases are going down, we reduce the intensity of interventions, but then we have to have a trigger level where when we see the number of cases rising again, then we put in place more intensive intervention. So there'll be, it's like a cycle of intense interventions, and then we relax them, and then intense interventions again, and then we relax them. So what we envisioned really is this thing is not going to be a short-term event, and that we'll have to get used to a new way of life. Social distancing will be part of our new way of life, avoiding mass gatherings, always washing our hands. So for now, I can't give you a date, because even now with this lockdown of Nairobi and Mombasa, Kwale and Kilifi, the government says 21 days, but that 21 days is not a guarantee. If during those 21 days, the number of positive cases that are detected increases, then the duration of the lockdown will have to be increased. But if during that time, the number of positive cases reduces until there reaches a point where we're hardly getting any new cases, maybe we're 0, 0, 0 for the last 7 days, then the government will say, yes, we can relax some of these interventions. Then there's another question from Abukayo. No, not from Abukayo, I think from John Wabwire. He's talking about the emergency supply chain. So the national government has a framework for deployment of medical countermeasures during an emergency. So already the government had a system in place that if there's an outbreak of an infectious disease, we know the things that we need, and then we know the quantities that we need. But you see, that framework was put in place for known diseases. So for example, if there was a case of Ebola, we know we need this, this, and this, because Ebola has been studied. But for COVID-19, this is a new disease. So there are some standard things that are there, like the personal protective equipment that Dr. Rono and Dr. Akoto were talking about. But there are some things that are unique to coronavirus. Coronavirus requires a lot of oxygen support for the patients. So what we're trying to do now as our support to the government is we're going to try and model the resource needs per county and see which counties require most support. Because when it comes to severe disease, you've heard that for coronavirus, there are people who are more likely to get severe outcomes. If you're elderly, if you have hypertension, if you have diabetes. And for us, we also have to put in the fact of HIV. If you're HIV positive and not compliant on your medication, or you're newly diagnosed and haven't been started on ART, then you'll probably be at increased risk of getting severe outcomes. So we are modeling to see where, how those risk factors are distributed across the counties, so that we can help in advising the government, this is where you need to put the supplies and the quantities you need. Welcome back, Felix.
Thank you. Sorry about, I really, really regret that. I'm not sure what happened. Thanks for the response. I don't even know how far you had caught my question before before you lost me.
So I didn't hear your question.
Yes.
So maybe you could repeat it.
So I was really wondering whether you feel that the protocols so far put up by the government are adequate to contain and flatten the curve. And then further, there has been this question where the government is asking young people to join the war. You know, it's a war cry from the president, from the government. Come join in, put in your effort. From your professional perspective, what do you think young people who are not necessarily health professionals can do to support their communities to be more resilient or to respond to this pandemic more adequately?
Okay, so first let me start off by making sure we all understand what flattening the curve is. So if we can all imagine this graph that shows the number of infected people over time, there's a point where it's going to peak, and that peak could be very high. So what we are trying to do when we say we flatten the curve is we're trying to lower that peak so it's not as high, not as many people get infected. And we also want to stretch it out so that we don't have a point where we have this massive demand for healthcare utilization. So it's like we want to spread it out so that the disease, if it does spread, it spreads slowly through the population so that, as Dr. Akoto was mentioning, there's a limit to the number of ICU beds. He doesn't want to have 200 people requiring ICU beds and he only has 20. So flattening the curve is trying to reduce that peak. So maybe 10 people require ICU beds due to coronavirus and he has 20. Because we must also keep in mind, those ICU beds are not empty. They're currently occupied with patients. So when the government talks about flattening the curve and the measures they've put in place, Felix, we're talking about the social distancing, the keeping about 1.5 meters away from people, staying at home, avoiding socializing, physical socializing, washing our hands, the cough etiquette, and now the face mask. Are they sufficient? The answer is yes, but they'll be sufficient if they're properly implemented. And it's in that implementation where we face certain challenges. When we talk about social distancing in a crowded market or in a matatu, it doesn't even make sense. But if we put it all together with the other measures, if you're wearing your face mask and you're washing your hands, then perhaps they'll have an effect. And then the government asks for the youth to join the battle.
Yes.
It's not that just the youth to join the battle, but everybody must join the battle. But I think why the emphasis is on the youth is that in Italy, you know, as the elderly people were dying, they realized that it was young people who were spreading the disease, that they felt invincible. So they would still go out to the restaurants, they would still go out to the bars, and then they go home and spread the disease. Also in America, if you're watching CNN, they recently had what they call their spring break. And so people went to Miami, they went to the beaches, they were having a good time. Next thing you know, 2 weeks later, you see that a lot of the students were COVID-19 positive. And then they transmitted to other people in the community. So perhaps there's the emphasis on the youth to understand that they have such an important role to play in stopping the spread of the disease. So when I think about what the youth can do, first of all, it's participating in this social distancing measures, but also it's preparing. Now I'm no longer a youth, now I'm now middle-aged, but it's preparing ourselves mentally, psychologically, and financially for the changes that are going to come. So as I mentioned to Emmanuel, this thing is not short-term. It's going to be with us for a while. So even the fact that we're having a Zoom meeting is we're being flexible. So we are adapting to the new surroundings, our new circumstances. So the youth need to have that mindset. All of us need to have that mindset that a change is going to be with us for a very long time and we need to be adaptable. And then also I envision at some point that if we get such widespread community transmission, we'll be relying on our neighbors to make sure that those people who are infected and are stuck at home have enough food, that they don't leave, that they are supported to maintain the self-isolation. And that's where the youth can come in, because even though the youth are at risk of disease, at risk of infection, they are not at highest risk of severe disease. So if it's anybody who's going to come out and support some of these measures, we won't be sending people over 60. We're more likely to be sending the youth, a healthy youth, to go out and be the ones to support in some of these measures that we have. Back to you, Felix.
Thank you. And I know that you will be leaving us in the next 5 minutes. So we will give you an opportunity to, probably make your closing remarks, but also just to answer one more question. And because I know with Dr. Anthony and Dr. Rono, I can blackmail them to stay here longer. So this morning, and again, just picking up from what you were saying, I was looking at news, CNN, especially in Detroit, Michigan, where while the Black population there accounts for just about 30% of the total population, they are responsible for close to 60% total infections and a high number of deaths in terms of those who've contracted the disease. And someone ascribed that to poverty. Now, when you come to Kenya and you look at our informal settlements, and you look and how we live in very congested places, and our means of survival are not so well. Do you feel that we need to do more to cushion our most vulnerable in the population, especially those people who live in informal settlements? And what more can the government do, or what more can we do as those of us who are on this call?
Okay, so Felix, that's a really interesting discussion. And I see you're saying it happened in Detroit, but I think also in New York, they're also seeing that it's places where Black people live and places where you have lower economic status that are most affected by coronavirus. And it's simply, for example, to do with overcrowding. If you're overcrowded in a place, then you're more likely to transmit the disease. In Kibera, people in Kibera pay more for water than people in more affluent areas. So if you have to pay more for your water, then you're not likely to hand wash as somebody who pays less for water. And then if you live on a daily wage, you can't afford to say, I'm going to work from home, because there's no manual labor that you're doing from home. So you have to get out. So you're putting your family at risk, you're putting your neighbors at risk, because you have to leave your home to get a wage. So when we see some of the things that are being done in Mombasa and by well-wishers in Nairobi in feeding residents, I think that's an important measure, because a hungry person, you can't tell a hungry person to be scared of corona. I think they'll feel hunger will kill them faster than corona. So making sure that they have food, but that is such an intensive exercise. So although I appreciate the work of the well-wishers, this really has to be government-led, because I don't think well-wishers have the capacity to map the at-risk populations and adequately feed them. And then the other option is what other countries have been doing is they've been giving some money to households to encourage them to stay at home. So if you know you have money, then you won't have to leave the house to go and work. But that system in Kenya, I don't know how feasible it's going to be. And then what can the youth do? You know, I wouldn't put it just to the youth, because right now we all have to be our brother's keeper. That if you see somebody struggling and you have a means to help, then you can provide that help. You can share what you have. You can educate. If you have extra, cloth masks, you know how to make a mask, then you can make that mask and share it with others. So there are many things that we could do, but really the government really has to do most of the heavy lifting. Okay. So I also have to leave in about 1 minute, but as I leave, I just wanted to say a few things. Yes. That this outbreak is a global challenge. There's no country in the world that knows how to handle it. That all of us, and especially in Kenya, we have to make our own way. We can't take what has worked in Asia or in America and put it in our setting and think it's going to work. We have to adapt it. And it's an opportunity for us to lead if we want to. So I'm hoping Dr. Akoto and Dr. Rono, as they are treating patients, they're also going to consider having trials to test different treatment regimens, because right now we don't have a cure. But perhaps if we tested different treatments here, we maintained our data, we did the analysis, we could also come up with something that, aside from hydrochloroquine and azithromycin, there are other medications that we could try. Yeah. But then also this outbreak has really exposed the weaknesses in Africa. We don't have our own manufacturing capacity when it comes to vaccines, when it comes to medical equipment, when it comes to ventilators, when it comes to the specialized PPE that Dr. Akoto was talking about. So I hope that the people on this call, when you're in a position to influence the manufacturing capacity in Kenya, that you also say that we must have independence in medical equipment production and medication, so that in case a vaccine is developed, we can also produce it here, not that we will be waiting in line for Europe and Asia and America to first protect their population before they think of Africa. So that's all I have. Thanks so much, Felix. Thanks, Nerima. And to my colleagues, Dr. Akoto, thank you for your sacrifice. And to the fellows, Imara fellows, I have so much faith that the next generation will do better than us because you've been exposed to more. So have a good rest of the discussion.
Thank you.
I really appreciate it. Thank you. So Dr. Akoto and Dr. Rono, there's a recurring question about people asking about immunity and how it is one of the things that needs to be focused on as we even anticipate a spike in these cases. So how do you feel that people who are locked in their houses today can still ensure that their immune system is strong enough to still contain these? Should they be at risk of infection? And then also in terms of, if you can also shed a bit more light in terms of COVID-19 carriers. At what point does somebody become, is someone able to transmit the disease to another person? Is it the first day when I come into contact with a positive case, or will it take a few days before I am able to transmit that disease? And what happens when I recover? We have 4 cases of people who have already recovered. Are they able to transmit the disease, or do they become immune to subsequent infections? Dr. Akoto. I'm not sure.
Thank you, Felix. Can you, Felix?
Yes, we can. I can hear.
Hello. Thank you very much. So, I think you've brought in.
Can we please allow Dr. Akoto to speak?
Yes, I can hear you.
Yes. Hello?
Okay, thank you. So you've brought in an array of questions, and my colleague just made a very important point, and which we are taking it very seriously. As doctors, we are currently trying out different regimens. As she had said, we do not have specific treatment to COVID-19 as we speak, but we are trying out different regimens. And what we've also realized is that different combinations are working in different populations and different risk groups. So it is something that we are still studying, but we will not sleep over the matter, because this is something that borders life and death, and all due seriousness is being taken by the medical practitioners. Now, there is this issue of immunity, and the question has been, how vulnerable are we? Which populations are most at risk? Who are the most vulnerable? From the few studies we've been able to see and what we've been able to follow is that the population that is aged, people above 50, 55 years of age, you know, as you age, your body immune system drops, and you become predisposed to many things, to many illnesses, to many diseases. So all the people, we are putting them out of this bracket in that we do not need to expose them unnecessarily because they are a category at risk. Second is people who have any comorbidities. What we call comorbidities are other chronic illnesses. This may include diabetes mellitus and other diabetes types, subtypes. This may also include issues like hypertension. It may also include people with cardiac diseases, people with previous history of chest infections, and like TB, tuberculosis, and asthma. It has been shown that there is higher mortality amongst those groups than the other general population. The other thing that we have also seen as a close association is people who with history of long-standing history of smoking and other chest inducing mechanisms with those problems also have been seen to suffer higher fatalities from COVID-19. So those are some of the general things that we would just wish us to understand. And as my colleague had earlier said, the young people seem to be stronger and they're able to overcome the disease, they're able to shed off the virus. But the challenge is that they pass it over to this other frail population. And that is where the role of the young people, the role of the youths now come in that we have to act responsibly so that we do not have to pass this over. The other thing that you had talked about at some point was issue of carriers. That
Yes.
are we having people who are carriers? Do we know of organisms or even fauna that is carriers? Of course, yesterday in some of the research journals, we were able to establish that the first COVID-19 case was picked out in a zoo in the United States, and it's something that we are still studying. But so far, we do not have a lot of data on it. What we know is that there is that human-to-human transmission, which has been proven, and we would want to and getting more information. The other issue also you brought out was the issue of recovery. And 4 people so far in our public have recovered. We are also following up a lot of these statistics. The reason being we are studying the dynamics of these people who have recovered. And we want to study their blood samples, we want to study the other cells in the body, so that once we come out to say that you have recovered, then it means that you are at no risk of, one, suffering the consequence or the pathological pathway of the disease, and 2, you cannot be able to transmit that disease to another person. We have also seen a few cases where people have recovered in that you cannot detect the virus in their bodies, but after some time, they get a reinfection and they are able to pass this virus to other people. So it is still a new disease that we are doing lots of studies on to be able to prepare adequately to manage the same disease. Second last, you also mentioned something about herd immunity. And this has been propagated by some scientists, and even the United Kingdom, the Prime Minister, the UK Prime Minister, who unfortunately now he is battling, Boris Johnson, the country was picking the pathway of herd immunity. Tanzania also seems to be picking that pathway, but still there is so as it starts. COVID-19 is still a ravagous disease that we will not wish to pass it to the population, because still we've seen fatalities, especially in the categories that we have talked about, which we do not feel it will be necessary to encounter that in our population, especially with our very weak public healthcare infrastructure. So I think with that input, unless if there is something else that I have forgotten, I will be glad to give clarification. Thank you.
Thank you, Dr. So we'll come back to you, but let me now flip these a little bit and talk to a few of our fellows. You can unmute themselves. I've seen Abukayo, Murunga. I have seen Tina from Busia. I've seen Lavender. So I want to ask a question to our fellows. Let me start with Oliver Baraza. What you are in a community setup somewhere. How prepared do you feel that people are? Do you feel your immediate neighbor, your immediate family members, do you feel they have all the information? Or are we making an assumption that when the minister stands every day and gives a press briefing, we imagine that we have informed every Kenyan, yet some Kenyans don't even know about this disease or about what is required of them. So how do you feel about the level of information in communities you live in? Oliver, can you hear me? Or any other fellow who is able to, who had my question and can just jump on board?
So, my name is Emmanuel.
Yes, Imara.
So basically, in a community I live in,
Yeah.
I wouldn't really say that they are totally prepared.
Okay.
But the basics of prevention, that is sanitizer, soap, water, they have the basic knowledge on what is required.
Okay.
But in terms of the press conference, hearing from the different organs in the government, I wouldn't say that they have all that information. Maybe if that information can be passed through other quarters, maybe the small groupings and bunges that are still in operation where people discuss and things like that, given people are actually staying at home. Yeah.
Thank you. Any other fellow who wants to share the experience of their community?
Hello.
Hello.
Yes, Lavender here.
This is Wilberforce.
Can we go with Lavender first, and then Wilberforce will come in?
Okay, Lavender. Ladies first, eh?
Okay, I just want to mention that there's a lot of myths that are going around, especially in the community. The proper information is not reaching them, so people are resolving to the WhatsApp forwards of, oh, this is a rich people disease, oh, Africans are immune to it. So as much as there's sensitization or there's communication from the government, there's still a bit of a gap in as far as that communication actually being absorbed by the people at the community level.
Okay, so you feel like there is still a gap. Wilberforce?
Yes, hi everyone.
Hi.
Yes, Lavender. I salute you with Emmanuel. So Wilberforce, I have a question here. We had an information from the newsletters.
Yes.
That when somebody has been affected with COVID-19 or coronavirus, then he get healed or recovered, he can either be affected, or it's just like a smallpox? When you are affected, you're affected. You won't be re-affected again.
Okay. So, Dr. Rono, if you can note that, Wilberforce is asking
And based
whether...
on your question,
yes. Wilberforce?
yes.
You were to say something and then you disappeared.
So I was asking the question about the recovery victims, eh?
Yes.
Dr. Cole.
Okay. Thank you for your question. So, Dr. Rono, if you can just note that Wilberforce is asking about chances of reinfection.
Is he available?
Any other fellow who would like to give a contribution?
John Wabure.
Yes, yes, John.
Yeah, being a community health worker,
yes,
I have been trying to sensitize the community about COVID-19, and
yes.
then I came forward that people doesn't really know how these things. They are asking me, why are we told every time to wash hands?
Mm-hmm.
So we have to tell them what to do, but most of the people are lacking knowledge about this thing. And the government, instead of training the community health workers or the community health volunteers primary health care, they are training the village administrator and administration chiefs who doesn't know anything about health issues. That it is bringing problems. People doesn't understand these things so far.
Okay.
Also,
yes.
Lon.
Yes,
Okay.
please.
I'm Abukaya Murunga from Busia.
Yes,
and just to add on what Laventa has said on community, there's a lot of misinformation, particularly in my community. You find that in most homes, most of these measures are there, but they don't know the importance of these measures. Like washing hands, how are they supposed to wash their hands? Are they just supposed to wash hands very roughly and just go eat or do anything? Or there's a way they're supposed to wash hands? Yeah, so there's a gap in terms of my community level of misinformation, and also just highlighting the importance of all this to the people. Because by the end of the day, as Dr. Dawa has rightly put it, that all these will be won or lost at the community level. So if young people are not going to engage the community, to engage the community in terms of the importance of the measures and why they should be observed, then we lose the battle on this. Yeah, so misinformation is an issue. Yeah,
it's a problem. Okay, thank you. So let me bring Dr. Ron. We will take another round of questions. So let me bring on Dr. and after Dr. Rono, Dr. Akoto. So Dr. Rono, there is that question about reinfection and the danger that it poses. And then you hear this theme about misinformation, about the government choosing to educate what you can refer to as the administrative bit of its presence as opposed to community healthcare workers. Do you think this is something that needs to change? And so in the same breath, Dr. Akoto, if you can comment whether even as KMPDU, is this a gap that you've noted, that we are not focusing on providing tools to the primary healthcare service workers at community level? And is this something that you can speak to, or even the union can speak to, in terms of advising the government to provide information to community health workers or include them as part of the trainings that they are giving chiefs and village elders and ward administrators? So Dr. Rono, if you can go first, and then Dr. Akoto.
Thank you, Felix. Number one, on the issue of recovered victims, people who had been infected before and now they don't have the disease, can they be reinfected again? Yeah, so the problem we have with this virus is that there is really not so much that we know about it at this point, and we are not so sure. The data that is available is not enough to make a conclusion that there's a possibility of infection. Hello?
Yes, we can hear you.
Yes, so there is we are not so sure, but if it behaves like other coronaviruses that we've interacted with before, so essentially you should be immune once you've been infected and cured of the disease. That is if we are to assume that it behaves like other coronaviridie or the viruses of the same family. For now, we don't have enough data to make that determination. I will answer your question about misinformation, but let me quickly go to the other questions that I've seen fellows asking.
Yes.
One is that how long do you estimate? And I think it was well captured by Dr. Adawa, that we don't really know how long it will last, but postulates have, we think perhaps in the next 3 months we will start to see the curve going down. If you see the situation of China, the curve is almost, it's gone down. There are basically no new cases as at yesterday that are like local transmission, and it has taken almost 3 months. Of course, it is also true that they really went out of their way. They used very strict measures. We don't know if our curve will behave like that. But even if you see other countries like Italy, France, Spain, even though they seem to be at the peak now, if you see the curve, it is like slowing down. And I feel like maybe in the next 3 months, we shall start having the cases manageable. Raymond has asked the capacity that we have to test right now. I think we can test about 1,000 to 1,500 cases per day. Even though currently we are testing between 300 to 600. So it means that we have not yet exceeded the capacity. And the conversation that we've been having even in our facility is whether we should lower the threshold for testing so that anyone that comes and says, I want to be tested, I have a sore throat, we can just do a swab as part of community surveillance. So that is the direction we want to take so that we can test as more people as possible. Dr. Akoto alluded to the strategy that was adopted by the UK, in which they were only testing those who are symptomatic because they felt like if you don't have symptoms, you can just stay at home. And we see that we don't know, we think it may not be working as well as it is as well as other strategies that have worked elsewhere, like Germany, whereby the mortality rate currently is less than 1%. And the strategy adopted by Germany is test, test, test. So basically test everyone who can be tested so that you are able to identify the cases, and once you identify them, you are able to isolate. So our strategy seems to be a hybrid of both, and we'll see how it works. But best case scenario is that in the next 3 months, of course, we shall start seeing an improvement. Milton has asked my opinion on the 100 million given by appropriated by the president for musicians. Yeah, I mean, it's true that that musicians need to be given some facilitation because, of course, they are not earning income now. But I'm not sure whether the president should have been the one to speak on that. I feel like our main focus now should be geared towards fighting COVID-19 and the strategies that are geared towards that specific goal. I feel like these others are just distractions that will not help in any way. If anything, 100 million is a very small amount of money. I don't even know if it will be enough for those musicians. Gabriel asked about immune boosters. Yes, it is true that if you have a better immunity, then you are likely to come out of this situation better than others whose immunity is poor. Of course, ways in which you can boost your immunity is a subject that will take a whole day to discuss. But generally, if you avoid smoking, if you have a condition like diabetes and you keep your sugars in check, if you are hypertensive and you keep your pressure at bay, then generally those are the ways in which you can keep your immunity okay so that you don't get affected. Of course, you can't help yourself from getting old. So that means we have to protect our old from getting it. John Wabure has alluded to something about community health workers. Yes, in fact, I don't know But this is a political issue. If only we had worked on the big four, of which one of the big four was health, then we wouldn't even have a problem in dealing with this. Because according to the Universal Health Coverage Strategy, then everyone was supposed to be brought on board, including community health workers. And these are the people who would be deploying to the communities to educate them. But of course, at some point, we missed the way and focused on other things. But this should be the time to refocus, and every single health worker now should be harnessed so that we can disseminate information to the villages, demystify the myths that somebody has said, somebody is saying, oh, it is 666. I mean, those are just, for lack of a better word, we can refer to them as crap. This is a disease in which there is no room for misinformation. This is a disease in which we just need to use science to combat it. Gabriel, can a dead person spread it? Yes, we don't have enough information yet on that, but we know that the virus, the studies that are available indicate that it can even last in surfaces. So even the clothing of the deceased, the body of the deceased, it can still have some virus, and therefore it is good to assume that even a dead body could still spread. Felix, you talked about Detroit and why the black people are affected more, and you said it rightly. It is because they live in ghettos, and we can only pray that this thing does not get to a place like Imara, because what will you tell them about social distance? I mean, they already live in very congested neighborhoods, and that is why in Detroit, in New York, Brooklyn, those are the places that are affected more than in other places. I think I've addressed most of the issues that were taken.
You've covered most of the questions that were raised. So let me bring in Dr. Akoto as you try to see whether there is any other one that you've left.
Yes, sure.
Dr. If you had had my previous question, and then
yes,
in addition to that, this is now an assignment that we had requested our fellows to think through. That if they were, for example, within leadership in county governments as members of county assemblies or within the executive, what more would you expect to see county governments do in terms of being more prepared and even better prepared to address this problem should it devolve to other counties? So what more do you want to see our governors doing? What more do you want to see our MCAs doing in terms of just making sure that our counties are ready to meet the need when the moment comes?
Thank you, Felix. One is I want to appreciate my colleague. He's been very, very generous with a lot of information, and now I will focus on the question you asked first, and that was on the community healthcare workers, and are we really empowering them, and is the strategy really working, or is there a gap we have missed? First, I will shock you, Felix, and the other fellas, is that unfortunately we seem to live in a society that does not value the input of professionals, and that is one of the challenges that the fellows maybe who are on this platform will come to experience once they are in the field, in that the technocrats can sit down and make very good policy papers, make very good on what you think should happen or what trajectory we should be taking. But those who hold the purse strings will send idea on where they will wish to put their focus and where they wish to put their money. And it's a very frustrating thing. For instance, when you look at the preparedness and the training that has been happening on the ground, it will have been very key if we focused more at the community level, in that we wish to have more of the border chairmen being trained. We have more of these community health workers, community health volunteers, community health extension, services. We will wish to see more of those, the sub-chiefs, the chiefs, the likurus being trained. We will wish to see more of these pastors, not just to ban churches, but church attendance, but to have more of these ministers, these pastors, the sheikhs, because these are the people who are in contact with a majority of the people at the community level. So our strategy will have been, apart from the healthcare workers, then these are the people where most of the resources will have been directed in terms of empowering the community with information, because as you said it rightly, this battle will be won at the communities. If we lose it at the communities, we cannot recover. We cannot recover. Example, when you look at Spain, when you look at Italy, when you look at the US, they made some mistakes, and there was an oversight in terms of stopping the disease from ravaging and spreading within a population. So still there is that gap, and even at the level of healthcare workers, if you looked at the survey that was done yesterday by InfoTrack, 80% of healthcare workers who are in both public and private sector responded that they are not ready. They feel they have not been trained adequately to handle this COVID-19 disease. And you see, that is a very big worry, because if 80% of healthcare workers will feel inadequate to handle the disease, now it leaves you imagining, what about the rest of the population? What do we think is in the villages? There is a big gap, and there is a lot of work that needs to be done, and we need to make the facilities, hospitals, the health centers as the epicenter of this training to ensure that everybody has been given full capacity. Apart from that, my colleague also made a comment on yesterday's note about the president and the 100 million. I think I will wish to correct. It was not 100 million, Felix and the fellows. I think the president was categorical that by the end of this cycle, he will wish to send 2 billion shillings to the artists so that they can keep us happy during this sad moment. And that just shows you where our priorities are as a country. Because as we speak, the population does not have masks. Prices for common medical things like gloves and masks and PPEs and protective personal equipment, in some cases it is above by 1,000%, 1,000%. And that is some of the things that we expected the president to address, so that the prices of these things like masks, it has been 20 shillings. Now it is going at 2,000 or 1,000. Even the simplest of them are 200 from 10 shillings. So you find this is a big abnormality, and even most of the people in the streets will not be able to afford. Because if you are doing a kibarua and you are working for 150 shillings, will you take out 200 or 100 to go and buy a mask that you will dispose it at the end of the day? So it is going to be a big challenge. So we wish that even as a country, most of the resources that the little resources should have been direct the county referral hospitals, the health centers, the national teaching and referral hospitals, the national laboratories, so that one of the strategy is like Germany, whereby we have a lot of people who we can be able to test and isolate them early, so that they should not pass this infection to others, so that we can control the chain, we can flatten the curve, we can have less people getting sick, and in that manner, prevention becomes cheaper and better than cure. But the path we are going is like, we want to have as many people who are sick, and then we treat them in our facilities, which will be a big mistake. Thank you.
Felix. Hello?
Do we have Felix? I seem to have lost him.
Can I address the issue of mask? Dr.
Yes.
Yeah, so somebody has asked about mask. I don't know if it's Lavender or someone. Yes, currently even WHO recommends that we wear a mask. Most of the masks, like the one I have, this is a surgical mask. It is less effective than an N95 mask, like filtering out almost 95% of the viruses. And there are also the cloth masks, the designers that are being made by the tailors. Well, the truth is they are, less effective if they have any effectiveness at all. But they are not as bad as nothing. Okay? So, please, from getting out of you, it can help you in preventing other people from getting the disease, even though it may not filter as much as would be. Even if it's 5%, it is better than nothing. So if you can access the surgical mask, if you can access the N95, then that is better. But if you cannot access any of those ones, any mask is better than no mask. Training of health workers at the ground level, I don't know, but in my, I have interacted with my people from my county, Kericho County, and they were telling me that people have been trained, that there are people who actually go to the healthcare facilities, even the dispensaries, to train healthcare workers. I don't know if the same is being replicated throughout the country, but that is definitely something that would be recommended so that healthcare workers don't run. Like, I don't know if it is a county whereby the healthcare workers ran away when a patient.
It was in Kakamega, I think.
It's your neighboring county. Yes. So we don't want such a situation because we are on the front line. And if we cannot be able to attend to the patients, then that would be very bad. The other thing is that this disease, it doesn't like present with features that are so unique that unaona huyu unasema this one is COVID. This is a disease that will present like any other, like malaria. I mean, the patient will have fever, just like a malaria patient would have fever, or like normal common cold. So it requires good clinical skills for you to determine that this is COVID and this is COVID. And that's, thank you for clarifying that even up to 2 billion is created for you. Staying at home. In fact, I had Murkom and the majority leader saying that we graduate medical students. And how can that be when we have 3,000? That tells you that the top is either incompetent or they are jokers. So there is need to focus all our energies, all the resources, everything. We should just be appropriating every available resource towards prevention and treatment. That is the only way we will succeed.
Dr. Rono, sorry to interrupt you. Collins, please mute your microphone. Collins, please mute your microphone. Yes, Dr. Rono, please go ahead.
Yes, so as I was saying, there is a lack of priorities in this government. Because even recently when we were discussing about the COVID-19, and we expect everyone, the president included, to talk of this singular issue. And what does the president come and do? He comes and launches some balloons, internet balloons. We don't refuse that these are important, but they are not important at this point. At this point, we want to hear the president say, we've hired this number of health workers. These are the strategies that we put. These are the ventilators that we've put in place just in case some Kenyans get sick. We did not, so there is serious lack of priorities, and that is what we would like to encourage our fellows, that even as you come up and take leadership positions in various places, learn to try as much as possible to listen to the technocrats, because that is the only way you will deal with this. And if you see the way Germany are doing it, it's the technocrats on the front line. Even in the United States, there are technocrats, including Anthony Fauci, They are always with the president and clarifying issues. But here we will find that it is the Matiangis of this world who are on the front line in fighting the disease, and we don't think that is right. Thank you, Felix.
Thank you for Dr. Rono is always a straight shooter, and we appreciate that. So at this point, we now have to start winding down, and I want to bring on board my colleagues, Nerima and Gabriel, and also Ken, in terms of going forward. We know that we had shared an assignment with our fellows, and we have received preliminary submissions. So we hope that the information that you've gathered here today will be helpful in you just going back and looking at that assignment and then giving it more thought, and then subsequently resubmitting it through normal processes. But we are also thinking as a fellowship of how we can position ourselves to be helpful to the ongoing efforts. And I'd like my colleague Nerima to try and speak to that briefly, and then we'll request Gabriel to move us towards closing after Dr. Akoto and Dr. Rono give us their closing remarks. So Nerima, please.
All right, thank you, Lon. Actually, I wanted to ask if Ken or Edith would like to speak, since they do lead this program. We haven't had their voices today. So Ken or Edith, please.
Ken, Edith? I know Edith has been doing 3 and 10 other things on the side. Ken, if you're able to hear us.
Oh, well, maybe just before Ken speaks, just to congratulate the fellows for all the effort that they're putting, first in ensuring that they submit their assignments on time, and even for making it to this meeting, as well as even taking the course offered by Future Lands. So we look forward to more submissions concerning COVID moving forward, and hopefully they can enable us to place ourselves effectively to help the society.
Awesome, thank you, Edith. So I think for me on my end, I'm very proud to hear the responses, just to see how active you guys are. And even just looking at the questions in the columns, I haven't met you all, missed that opportunity, but just hearing your voices today, some of you I've met, some I haven't. I think this was my first interaction mainly. And just to say that you're so brilliant. Also to thank Dr. Rono and Dr. Court as well, just to be able to give their time, because I know that they're busy during this period. I can't even imagine what they're handling during this process. So I guess it's just to say before I hand over to Gabriel that who would have thought here we would be discussing viruses? Who would have thought that it would make an impact even to our communities and an effect? And also considering that we are in a position of privilege, the fact that you can log on, get on the internet, decipher information, we can safely say that our community members don't have that same privilege and access. So what does that mean for us on the ground in terms of even communicating? To hear comments as to how the public are wondering how many times they wash their hands, how do they do it, why are they doing it? These are things that you will deal with firsthand, because I'm sure your very communities, your leaders, yourselves. So I'm sure the questions come to you and the confusion comes to you, and to see how our government is handling the situation, and also concerned for our communities as to whether we'll be able to get the proper help in time and what we can do about it. So it just goes to show you that when we have a program such as Imara, we never thought that policy would ever come into our lives, but we're seeing that it takes several stakeholders to come up with policies. So even as you're thinking about your group work and the activities that you've been given and working on that, is just to simplify it. We're not looking for technocrats or to see how many ambiguous words or big words you can use in a document, but simplify, because I already feel that in terms of communication and having the community engaged, our government is not doing a good job at that. So we've seen young people come up and translate the information into different languages, and also using images, because it doesn't necessarily mean that everyone we interact with reads or passed primary school. So it's just to say that for me, I'm blessed to even hear your voices, your comments, and just hope that you have a blissful week as well. Thank you.
Thank you very much, Nerima. Gabriel?
Well, this was good, but before I say something, I think there's a Baraza Oliver who's really been for a very long time trying to get to say something. I think he's been raising his hand, he's been sending messages that he'd like to say something. So I guess it's just fair to give him a minute to say what he needs to say. Baraza, can you hear and can you jump in? I'm assuming you're the one here. Okay, there seems to be a challenge. Okay,
Hello.
Baraza, yeah, yes, go ahead. No.
Okay, thank you. My name is Baraza. Several technologies by profession who are on the front line of testing the COVID-19. So my worry is about what Dr. Rono was saying about testing one of the strategy that every country or any county government is employed. But at the moment, in this country, as a professional medical laboratory science, I'm worried how the county government is prepared to maybe to test this virus, because with my knowledge is, I understand there's no any county referral hospital currently that is well equipped with any PCR machine or ELISA and biosafety cabinet level 2 to be able to process these samples. Because if these samples are processed in an open air, it means that all health workers within a laboratory are exposed. Secondly, about the issue of how the policies that have been made in this country on the laboratory department. You find that in this country there are many graduates who are coming out in the universities, especially in the on degree levels. But you find that the board regulates the medical laboratory of 1999 hasn't been able to be amended so that they can absorb the graduates in the public hospital. Currently, we have only the diploma holders in these public hospitals, especially in the county referral hospital. And this means that some lack technical how to run this machine, how to calibrate them, and in finding like there's a lot of positive results about this COVID-19, which I personally have been able to handle it. So I've been able to come late, I'm sorry, because I'm at work. And these are some of the things I just wanted to hear as the KMBDU, because we have been able to reach them through NUMLO to ask them to help us to amend this act so that those people who have the knowledge and the know-how how to test and to run this machine can be able to be absorbed in the county governments and also our hospitals.
Okay. Thank you, Baraza. And I don't know right now that you've raised some issues that someone needs to address, I am not sure how to handle this. I know we need to finish, but I believe since you've said you're on the front line of testing and everything, this probably is an information that if maybe, and I'm seeing Dr. Rono walking out, maybe
we can ask maybe Dr. Akoto to make a comment as he
make a quick comment. Yes. Akoto, I didn't see him. I thought he had gone also. I didn't see him. Akoto, please make a quick comment on this. Okay, there's
Thank you very much to that colleague. Is he Baraka Oliver? Yes, the laboratory scientist. So I think he has raised very valid concerns, very valid things. Number one is that, as I said earlier, to be sincere, the county preparedness to COVID-19 is still
Is it me or Akoto's connection is not clear?
I think the is very low.
Yeah. Hello?
As we talk, we do not have any county referral for laboratory or facility that is accredited to the level of doing those.
Hello, Dr. Akoto. We can't seem to get at all what you're saying.
I think we can pick his response if he's listening, maybe via text.
Yes.
Oliver, you can get in touch with either Ken or Edith, and they will facilitate you to pass this information to Anthony, who, like you rightly said, is within KMPDU, and if that is something that they can take up.
Yeah, because I think that's fine. For me, unless Dr. Rono wants to say something very quick, if there's none, I think we'll just finish at this point, based on what Baraza asked. Okay. I can't get him if he's saying anything. So, Dr. Rono, if you are saying anything, we can't get you.
I think he's left the boardroom.
Okay, great. So I guess we'll finish. Thank you, guys. This was great, and I wish there'd be more like such, because this corona issue, there's a lot of scanty information out there, and sometimes it's just finding where can we get authenticated true info about this. And thank you for the doctors we had, Dr. Koto, Dr. Rono, and Dr. Dawa, who left earlier, who really gave us the right information we need to have. So I think mine is to thank you for availing yourself for this. Someone's name is making a lot of noise. I don't know who it is. I need to look for it to mute it. So mine is to say thank you, guys. And then I think this doesn't end here. This doesn't end on this conversation. I guess as we go and as we engage, I know there's assignment you're doing, but beyond that assignment, I know we come from a community setup, and some of you, of course, have challenges you're dealing with in the community. I guess I would say that the Secretariat would be more than willing. For example, if you'd say, I'm having a challenge, can you guys help me get someone who can help me get the right information to address this particular issue? Because this seems to be a concern coming from my community. At least that's a help that the Secretariat would be willing to have, so that at the end of the day, we are not just there to give you information, but also to get you to do the assignments, but also to really be practical in you solving the immediate needs around your community. So Thank you, guys. As Nerima said, I think I'm the same boat with her. I'm just seeing names that I would really love to really get to interact with at some point. And so we hope the time will come that we'll be able to put faces to the specific names and be able to continue the friendship and the interaction as we continue to serve in our communities in different levels. So all that to say, thank you. I believe this should happen more often. And Lon Felix, it was a good idea that you brought this up, and I think we should do this more often. And even if we could establish some form of a regular, just checking in and finding out what is happening, how are we coping up with everything, what are some of the challenges, and of course, occasionally having experts come in and address some of the issues would keep us going as we go through this engagement. So thank you very much. And I believe that is, unless there's something that really needs to be communicated, I think we can just maybe close. And since we did not start with a word of prayer, I guess it would be good just to close with it, if that's in order. So I don't know if Lon or Nerima, there's something that really you feel need to just be thrown in so that it's not forgotten. If there is none like that, then I would probably say a closing prayer.
Thank you, Gabriel. None on my side except my human friends who are on this call. Let's not get too much information and forget to take care of ourselves. So let's keep safe wherever we are.
Wash mkono, to keep safe distance, or the space, whatever, the social distancing, and we use masks. Yeah, I know that has been said until it sounds like a broken record, but I think it's important that is said. Nerima, anything?
No, none on my side, Gabriel.
Good. Great, let's pray. Lord, we honor you, we give you praise, and we thank you for the opportunity, Lord, to do such amazing conversations, Lord. Conversations that challenge, that inspire, that inform, that, Father, Lord, lead to transformation of individuals and communities, Lord. We don't do this for granted, but we do this because deep in our hearts, we have a desire to bring transformation to our communities. And Lord, we pray, Father, my Lord, that even as we do these basic, simple steps of just conversation and doing some practical assignments and practical engagement, you give us the strength, you give us the energy, you give us the power, give us what it takes, Lord. Translate all this into action, translate all this into transformation in our communities. At the end of the day, when we are done with all this process, it will not just be another process that we went through, but our lives will never be the same and our communities will never be the same because we chose to commit to a process. So Lord, be with us as we go through these challenges that sometimes make us question a lot around us. I pray, Lord, that Father, my God, you bring clarity, you bring the right engagement, you bring the right platforms of engagement, that we are able, Lord, to stand together and stay strong, Lord. We pray that you walk the journey with us. Remember our families, Lord, keep us safe, keep our families safe. Anyone connected to us who might be going through situations, I pray, Lord, that you stand with them, Lord. Be with us today, even as we face the rest of the day. In your name I pray. Amen.
Thank you. Keep well.
Amen.
Such a pleasure.
Okay, great. Anyone feeling like they want to remain on the platform to catch up? I think it will keep running for as long as you want to remain to catch up. It will not stop. So just feel free to remain to catch up if you feel like. Have a nice day.
We'll stop recording.
Yes, we will stop recording. Thank you for that reminder. And we'll stop recording from there, and then guys can catch up if they want.